Hi everyone, welcome to the Big Ideas Theater here at AARC. I'm Ed Highland, and I have the pleasure now of being joined by Cynthia Kanaki with the ALS Association. Cynthia, thanks for coming by and joining us.
Thanks so much for having me, Ed.
We want to talk about ALS as a big picture, but also about this multidisciplinary approach that you're going to be talking about. So first, can you give us the big picture on ALS? You know, what is it and how is the current methodology for treatment?
Amyotrophic lateral sclerosis, Lou Gehrig's disease to baby boomers, and the ice bucket disease to millennials is actually a degenerative neuromuscular disease. In ALS, the motor neurons die. That results in paralysis. So people are unable to walk, to talk, to eat, or even breathe. The course of the disease typically runs 3 to 5 years, and unfortunately, people generally succumb to respiratory failure.
Give us some thoughts. We talked about multidisciplinary approach to the treatment of ALS, the clinics. Why is that necessary? Why is that something that is being brought up at this time?
Well, since the Ice Bucket Challenge, actually nearly 20 different genes have been identified that are associated with ALS. And what that does is it gives researchers some really robust information with which to investigate potential treatments for ALS. Maybe identifying a combination or a compound that might lead to something that would change the course of the disease. Right now, we don't have a cure, but we do have medications that can alleviate the symptoms associated with the ALS. So we can mitigate some of those issues that people are dealing with. Issues associated with mobility, with communication, with eating, and even with breathing.
Yeah, I was going to ask, how are these approaches actually benefiting the patient? This is a condition that's as you say, progresses over 3 to 5 years, sometimes very quickly, as we were discussing before the camera started rolling. So how does this multidisciplinary approach actually help the patient?
Well, imagine a progressive disease that impacts your mobility. Respiratory therapists are working very closely with the physical therapists at the multidisciplinary clinic in order to provide the patient with appropriate seating. Appropriate seating supports the person being in a correct position so that it decreases their work of breathing. Many people don't think about how a power wheelchair might actually decrease your work of breathing, but working between the physical therapist and the respiratory therapist, they provide appropriate seating and support so that person's breathing work is actually decreased. We look at the dietitian. The dietitian can develop menus and eating systems so that that patient can maintain the caloric intake they need in spite of the fact that their metabolic rates increase with ALS. The same thing with the speech therapist. Speech therapists and respiratory therapists consult with each other to address issues associated with swallowing and, very importantly, protecting that airway, making sure that that patient's able to maintain a clear airway. And then you can expand on that. Occupational therapists assist families and patients with the ability to navigate around their home now that they're in a large power wheelchair. And the social workers are able to work with families to navigate that complex healthcare system and end-of-life issues that's so often associated with ALS. So you can see that a person diagnosed with ALS has some significant respiratory challenges, but at the same time, we're able to work together to address those mobility challenges, those challenges with nutrition, with communication, at the same time addressing those respiratory challenges.
And you were saying that's increasingly important as slowly but surely some newer medications are coming on the market, and these patients are being given, often giving a chance to live beyond that 3 to 5 year window, 10 years and perhaps more.
It is. Right now, we do have several medications on the market for people with ALS that impact the rate of progression of the disease. So we don't have anything that's going to abruptly change the course of the disease, but there are certainly medications that can address the progressive nature of the disease, and also medications that address symptom management. And that's highly valuable for people living with a degenerative disease.
Does the treatment change as the patient progresses with this disease? In other words, is it a constant, I don't know about daily, but is it a constant challenge for the therapist to come in and say, okay, how is my patient this week? How do I expect them to be next week? And that type of thing? Or is it that clocked out?
Well, Ed, it is a progressive disease, and what that tells us is we can anticipate that that patient's disease, their symptoms are going to progress each time we see them. Those symptoms may become more significant, or they may expand beyond the different regions of the body that they're currently impacting. So we anticipate that that person's symptoms are going to be progressed. And while we can anticipate that, we can also bring in, ahead of the curve, so to speak, those things that are going to be able to support the quality of life for that person, whether it is an issue with mobility or communication or nutrition or even respiratory issues associated with ALS.
How critical is it for the respiratory therapist, the clinician, to be able to communicate with the patient before they lose the ability to communicate? In other words, as we've discussed before, the muscles will begin to go, it'll become difficult for them to say, I'm having this issue or that issue, and actually verbally express, what's happening to them.
And that's the value of the multidisciplinary clinic, because as patients are referred to the multidisciplinary clinic model of care early on in their disease, they're able to really experience the benefit of having all of those disciplines, see them together, and then develop a care plan that is going to support them. Of course, that patient and their caregiver are critically involved in that care plan, because we know it's a progressive disease and we want that patient to be able to identify what quality of life means to them. As that disease unfolds for them, the different disciplines are there to provide changes in support or equipment or techniques or care that are going to support that family in what their idea of quality of life is.
So the patient and the care team literally have to sit down together and map out the course of progression for this.
Absolutely. The multidisciplinary care team actually turns into an interdisciplinary care team.
Is it always the same team, or does the team change out? In other words, as the patient perhaps progresses with the disease, are there people with different levels of expertise that need to be brought onto this team?
Typically the multidisciplinary care team is the same team, and one of the values of that is because these team members have expertise in treating people with ALS. And that's very important because ALS is often thought of as a very rare disease. So an experienced respiratory therapist, for example, may work in ICU for 20 years, yet they may never see a patient with ALS. So it's really important for patients that are attending a multidisciplinary clinic to be able to garner the value of the experience of all of those different disciplines with ALS, the disease.
Just a final question on ALS, because I'm curious. For a long time, we were talking about how the Jerry Lewis Telethon raised awareness of neuromuscular diseases, including ALS, and then more recently, the Ice Bucket Challenge kind of brought another generation, if you will, into it. Are you seeing that? Are you seeing that the public generally is fairly aware, at least has heard of ALS before? And importantly, is funding coming about to continue the important research needed to maybe one day find some treatments?
Absolutely. The Ice Bucket Challenge has increased the awareness of ALS, both in the community, those people that are diagnosed with ALS and their family members, and also in the professional community. We're now getting questions from respiratory therapy societies contacting the ALS Association and asking us, can you please come present on ALS to our membership, because we realize how critical appropriate respiratory care is in this patient population. And that leads back full circle to those multidisciplinary clinics. Right now we don't have a cure for ALS, and while we're furiously researching for that cure, for something that's going to change the course of that disease, we still have things that can address quality of life for those people. Research does show that attending an ALS clinic actually increases longevity. So that's more than just hope for people facing a fatal disease. Attending an ALS clinic increases longevity, it supports quality of life, and it provides patients and families access to evidence-based care. All those things together really support that patient and that family's idea of quality of life, and that's what we want to do as therapists and healthcare professionals.
And RTs play a critical role as well.
They do.
Cynthia, thank you so much for coming by and joining us.
Thank you, Ed.
This is the Big Ideas Theater at AARC. I'm Ed Highland. Thanks for joining us.